And so the patient comes in and says, well, I know my uncle got this cortisone shot in his knee and he said he felt great. I want a cortisone shot because I'm in pain.
Right.
Can we talk about
Yeah.
what that injection's
Yeah,
about?
yeah,
Yeah.
so there's like I can unpeel this in a couple of different ways, but I'll try to stick to the basic ideas, right? So cortisone is a fantastic anti-inflammatory and extremely good locally acting. So if the primary problem for your pain is inflammation from something, it could be anything. It could be a torn cartilage, it could be torn meniscus, it could be instability, it could be a kneecap that's dislocating, or it could be a host of other things like Lyme disease and rheumatoid arthritis. And you can go on and on and on. I know we don't have that giant time to discuss. That could be another
It's
show.
all in the book, but it is all in the book.
So it is in the book. But at the end of the day, you have to dissect out what am I treating and why am I treating it. So going back to two pieces of that, again, some patients, they have a tournament this weekend and you're treating them because they want to give a shot so they can play better this weekend because they know their knee is painful and they want to have the weekend to do it. And when I was a young physician, I'd get some guy who's 70 or 80 years old wearing two braces and limping and come in and say, Doc, you got to give me a shot. And I'd say to them, you're crazy. Why are you still playing tennis? You're going to hurt yourself. And then as I got older, I started to have a better appreciation for the aches and pains of life.
Yeah.
And now, I have a patient who's 80 years old, who's got his arm taped up and his elbow taped and two braces on, and they hurt themselves and they have a tournament this weekend. And I'm almost like, where do you want the shot this week? Which is not, I wouldn't say that's the generally right answer, but if it is the right answer for them for their acute
Yeah.
inflammation and it is the best choice at the moment, I am happy to give it to them to restore their quality of life. So if we're giving the shot because there isn't a lot of choices, the patient isn't going to go for a surgical option, they know it's going to last 6 months at best to a year, and we know that the end game might be a knee replacement at some point, then it's not unreasonable to do it a couple of times. I have a hard rule. I don't like to do it more than twice a year. If you're doing it 3 times a year, then I don't know what's wrong with you. I'm not really treating the problem. So that's a rule of thumb for me. The other rule of thumb is I never say yes to someone who just says, hey, doc, just give me the shot. I say, no, tell me what's wrong. Let me examine you. Let's get an x-ray. Let's make sure it isn't Uncle Benny's tumor first, because I'm not giving an injection into a tumor. And let's do all the things we have to medically to kind of piece together what's really wrong. And then I can counsel you whether the shot is a right idea for you. I think you're into this a little bit, and I'll take a little sidestep onto glucosamine and chondroitin, because that's something people ask about all the time in various supplements. And I have a little rule of thumb. I was actually talking to a well-known sports person years ago, who's at Harvard, and she's a delight. She's fantastic. And she said something very clever to me, and it stuck with me, and I think she's right, in that she said, if you use these things and you do it for a month and then stop for a week, and you're looking for the bottle, there's a good chance it's helping you. If you stop for a week and you don't miss it, and you're not looking for the bottle, there's a good chance it made no difference. So some people are on glucosamine or food supplements for years and years. And if you ask them the question, do you know if it's helping you? And they don't know. They have no idea. And I said, how about stopping for a week and see if you're looking for the bottle? And a lot of people say, stop for a week, doc, I don't feel any different. I wasn't even looking for the bottle. Okay, it's not working for you. And there are some studies that show that glucosamine in some settings in Europe, there was a big study of 600 patients that showed it's just as good as Celebrex as helping people feel better for bad knees and some bad joint issues. And then we do give it to our dogs and horses with some success. So I do think there are people who are responders, if you will, who will take glucosamine and have fantastic result. And I think there are plenty of people who are non-responders. So the acid test of taking it for a month and then stopping and seeing how you're doing without doing other interventions. Obviously, if you do 6 things at once, you never know, right? I give someone a shot of cortisone, then they take the glucosamine. They said the glucosamine worked, and you're taking the anti-inflammatory and I gave you a shot. Not sure the glucosamine was the number one thing.
Well,
on the list.
they got that for $30 at Costco. So, that was
right. A little bit less than the copay, maybe, So if you do it in isolation, you can piece out whether or not it's working for you. But I tell people to listen, if you know it's not making a difference, don't continue. There's no reason to do that. And there's some caution in diabetics. They don't really want them taking glucosamine because it has some sugar in it. And diabetics could be taking a lot of glucosamine, not realize it could be throwing their sugars off. So there's some cautions there. So nothing is as straightforward as people like to think. A lot of food supplements have other issues, and then you have to be a little careful.